So whenever I'm ordering implants, the most important thing is to make sure that I order the right size implants for my patient. So usually I'll order a couple extras just in case I need them, but they come in very quickly. Within about 48 hours, I get the implants ready. And in certain cases, like today's case, I'm not exactly sure which implants I'm gonna use because I know I'm gonna use one on one side, but the patient has very different size breasts, so I'm gonna use a different size implant on the other one. So for those cases, I order a lot more implants so that I can size them and see which ones look perfect on the table for better symmetry. So in the office, I have a sizing kit. I use this on patients so that they can wear actual molds of breast implants into their bra and they can wear their favorite shirts and outfits to see how they're gonna look. But for some patients, it's very hard to tell exactly what size they're gonna get because maybe they have baseline asymmetry or very different size breasts. In that case, during the surgery, on top of that, I also use a sizer. A sizer is a temporary implant. They come in multiple sizes and I can just use them, put them in the breast, have the patient sit up, make sure it's the right size before I put a permanent implant into the patient.